In this section, we're going to talk about environmental influences on genetic disorders, and we'll conclude with a short discussion about diagnosis and counseling. Teratogenic describes any chemical, physical, or biologic agent that produces abnormalities during the development of a fetus or embryo. Specific organs are sensitive to teratogenic agents at specific times during the pregnancy. For example, the heart is developing between 3 and 6 weeks, so exposure to a teratogen during this window makes the baby more susceptible to heart defects. Teratogenic agents include radiation, chemicals, drugs, and infectious agents. Alcohol use during pregnancy can cause birth defects and developmental disabilities. Your textbook refers to this as fetal alcohol syndrome, but you'll also hear the term fetal alcohol spectrum disorder to describe the conditions that can result from alcohol consumption during pregnancy. And they're on a spectrum of severity. The incidence of fetal alcohol syndrome is difficult to pin down, but it could be as high as 1 to 2 cases per 1,000 live births. Babies with fetal alcohol syndrome are typically low body weight and have small heads. They may have poor coordination and difficult sleeping, and also difficulty sucking. As children become older, they may be hyperactive, have difficulty with attention, have memory issues, speech, language delays, intellectual disabilities, and resulting in problems in school. There are some typical facial characteristics, and these may not be present at birth, but tend to become more prominent as the infant develops. These include the small eye openings, smooth philtrum. The philtrum is that ridge that's between the nose and the upper lip, and a very thin upper lip. Binge drinking seems to be particularly problematic for fetal alcohol syndrome and for babies in gestation. And if binge drinking happens during specific organ development periods, then a wide variety of organ development problems can result. Since we don't have any idea how much alcohol is safe, it is recommended that mothers refrain from alcohol during their pregnancies. Cocaine causes significant vasoconstriction, and this is true for both mom and baby. Vasoconstriction causes hypertension in the mother and results in decreased blood flow to the uterus and the placenta. Cocaine can also stimulate uterine contractions, and that puts mom at risk for going into premature labor. Studies have shown that excesses of vitamin A can also cause fetal malformations, including malformations of the skull, the face, the arms, the legs, and the central nervous system. Retinoids, we're going to talk more about in pharmacology, but they're commonly prescribed to treat acne. And you'll learn in pharmacology that retinoids are very cautiously prescribed to women in childbearing years. In fact, retinoids won't be used unless the patient agrees to a pregnancy prevention program while they're on the retinoid therapy, and for a period of time after the therapy is discontinued. So too much vitamin A can be teratogenic, while too little folic acid can also be detrimental to a developing fetus. If mom is deficient in folic acid, then the baby is at higher risk for neural tube defects like spina bifida. Folic acid supplements are recommended for all women of childbearing age, and should be discontinued when, should be continued when the woman becomes pregnant. And now we're going to talk about teratogenic defects associated with infectious agents. And the acronym TORCH stands for toxoplasmosis, other, rubella, cytomegalovirus, and herpes. These are infectious agents most commonly implicated in fetal anomalies. So the other disease listed can also cause birth defects if a pregnant woman is exposed. The defects can present as growth problems, abnormal brain development, abnormal development of any organ, eyes, ears, liver, lungs, heart, and also even abnormal blood cell formation. The manifestations will vary between different babies, but the good news is only a few babies are born with multi-system problems. As a nurse, if you are assessing genetic risk, you would likely be working with a geneticist. In that role, you would obtain a detailed family history, including a pedigree and a pregnancy history as well. An assessment of the birth process and of the baby's postnatal development and their health would also be important. The geneticist would also examine the affected child and the family members, both those who were actually affected family members and those who were not affected. Everyone would be examined. And there would also be some laboratory tests to assess their genetic situation. A prenatal screening is designed to diagnose specific or common disabilities, but it's important to realize that not all disabilities can be diagnosed with prenatal screens. The goal would be to provide parents with as much information as possible so that they can make informed choices about having a child with a genetic abnormality. Because many women are delaying pregnancy, advanced maternal age increases the risk of babies having a genetically inherited condition. So prenatal screening in high-risk groups like advanced maternal age can reduce some anxiety for these parents. If a prenatal screen is needed, it could include maternal serum markers. These would identify pregnancies that are at increased risk for certain disorders. Ultrasound, amniocentesis, chorionic villus sampling, which is basically a form of blood sampling from the fetus near the placenta. And in that situation, they would look at the DNA and chromosomes. There might also be the need to take blood from the umbilical cord, which they would do through the mother's skin. So that's percutaneous, means through the mother's skin. Cytogenic and biochemical analyses are performed on samples that are obtained by amniocentesis or by chorionic villus sampling. It is also possible to do a fetal biopsy. However, these are becoming more rare as our ability to understand and to look at actual genes and chromosomes improve. And this concludes our discussion of Chapter 5.